how are you?
Good.
My name is Emily. I'm a nurse practitioner student at Touro, Nevada. How are you doing today?
Good. How are you?
Good, thank you. I'm just going to practice some hand hygiene right now. So you're here for the cranial nerve exam. Is that okay?
Yes.
Okay, can you please verify name and date of birth?
Lynette Martin, 5/13/1970.
Okay, perfect. So we're going to start by assessing cranial nerve number 1. That's the olfactory. That's the one that helps us with the smell, okay? It's a sensory nerve.
Okay.
So I'm just going to check the patency of your nose. Can you please close one nostril and breathe for me? Thank you. Now the other one. Okay, so nostrils are patent. So now close your eyes, please. And I'm just going to ask you to close one of your nostrils. Okay, perfect. And what do you smell?
Smells like coffee.
Okay, perfect. And now the other one, please. Close the other one. All right, and what do you smell?
Smells like cinnamon.
Okay, perfect. Thank you very much. Patient was able to distinguish smell, so cranial nerve number 1 is intact. Now cranial nerve number 2 is the optic nerve. So I'm going to check your vision, and we're going to do some confrontation tests. And then I'm going to check your eyes as well. Cranial nerve number 2 is a sensory nerve as well. I have this Lenin chart on the wall. Can you please tell me, do you wear glasses usually?
Yes.
Okay, perfect.
Glasses or contacts, yes.
Okay, perfect. So can you please tell me which is the smallest line that you can read?
The very bottom, I
Okay.
believe, is an LYF.
Okay, first I'm going to ask you to just close your left eye. And then with the right, go ahead and read the smallest one.
Okay, looks like, well, the second line up is CFDHJ, and then I think it's,
Okay.
I am almost,
Okay.
could read the bottom line.
Okay, that's perfect. So now the other one, please, with the which one with the left eye? Which is the smallest one that you can read?
Probably the third line up.
Okay, so go ahead and read for me, please.
All right, it's probably the fourth line up.
Okay.
It's DNJ BH, I believe.
Okay, so patient is 20/20 on the left eye and 20/30 on the right eye. And now we're gonna do a confrontation test. So can you please stand up?
Sure.
Okay, and then just facing me like this.
Facing
Look at
you?
me. Yes, right in front of me.
Mm-hmm.
Okay, that way. Okay, like this. Okay, a little bit that way. All right, thank you. So close your right eye, and then I'm going to close mine, and then I'm going to show you a number. Okay, so
Okay.
you always look at my nose,
Okay.
and then I'm going to show you a number. You tell me which number you see.
Okay.
2. Okay, look at my nose.
Got you. 1.
Okay, close the other eye. I'm going to close my eye too. Now with the right.
2.
Okay.
3.
Okay, perfect. Confrontation, go ahead and have a seat.
Okay.
Confrontation fields are full. Now I'm gonna check your vision. So can you please, actually your eyes. Yeah, please take your glasses. I'm gonna just check your retina. Let me make sure this is on. And that it's focused. Okay.
Okay.
So I'm gonna assess your eye. I'm gonna first do your right eye with my right hand.
Okay.
And then I'm gonna go on the other side, on the left.
Okay.
And I'm just checking your retina, your disc, your margins, your arteries, okay?
Okay.
Alright, so I'm gonna hold on to your eyebrow. This has to be arm's length. And then I'm gonna find the red reflex. And then I'm gonna get closer, okay? Okay, perfect. Okay, so go on. Okay, perfect. Alright, okay, perfect. So retina is red and orange color. The disc is white and creamy. The margins of the disc are sharp. There's no hemorrhage, no edema. And the veins are actually 2 times larger than the arteries, which is normal. And there's no tortuosities that would be seen at like diabetic retinopathy, okay?
Perfect.
So now I'm gonna do it on the other side. I'm gonna do left, left, left. So I'm gonna hold on here. This is my left hand. Again, I'm gonna find the red reflex, and then I'm gonna check your eye, okay?
Okay.
Okay. Okay, perfect.
Okay.
Again, retina was orange and red in color. Discs were creamy and white. The margins were sharp. There was no edema. There was no hemorrhage that I saw. Also, the veins are also twice the size of the arteries. Okay, so cranial nerve number 2 is intact. Now we're gonna check for cranial nerve number 3, and those are 3, 4, and 6. We actually check them all together. So 3 is ocular motor, and all of 3 of them are motor nerves. Ocular motor, number 4 is called trochlear nerve, and it helps with the inferior and medial movements of the eyes. And the cranial nerve number 6 is abducens, and it helps with lateral movements. Okay?
Okay.
Alright, so first I'm gonna check you for pupils. So I'm just gonna look at your pupils real quick
Okay.
with my pen light. Okay, perfect. So pupils look like they're about 3 millimeters bilaterally. Now I'm gonna check if they react to light. Okay, so go ahead and just look at the wall. Okay, it reacts. Okay, and I'm gonna check consensual. When I shine this one, I'm gonna look at the other one. Okay. Okay, perfect. So I'm gonna check for accommodation. Well, pupils are reactive to light, and so go ahead and look at the wall.
Okay.
Now look at my pen.
Okay.
Now look at the wall,
Mhm.
and look at my pen. Okay, perfect. So pupils are equal, round, reactive to light, and they also accommodate. Now I'm gonna check the gaze of your eyes with the 6 cardinal positions. So I'm just gonna ask you to look at my finger
Mhm.
and follow my finger. Okay, very good. So movements are present, they are equal bilaterally, they're symmetric, and there's no extra movements of the eyes. Okay, now I'm gonna check for the bridge of your nose, and then I'm just gonna ask you to look in front of me, look at the wall,
Mhm.
and I'm just gonna shine this light in front of your eyes,
Okay.
and I'm gonna look at the light, okay?
Okay.
Alright, so corneal reflex is symmetric bilateral. Okay, so I can see them at the same spot.
Okay.
And now I'm gonna do the uncover test. And I'm just gonna ask you again to look at the wall directly. I'm gonna cover your eye,
Mhm.
one eye at a time. And then I'm gonna uncover and cover and uncover. I'm just looking for extra eye movements.
Okay.
Okay, go ahead. Okay, perfect. Okay, so there's no extra movements. You okay?
Mhm.
So cranial nerves number 3. So there's no misalignment. There was no nystagmus. So cranial nerves number 3, 4, and 6 are intact. And now we're gonna go to cranial nerve number 5, and that's the trigeminal nerve. That's sensory and motor. So for number 5, I'm just gonna check your jaw, and then I'm just gonna ask you to, I'm gonna touch it and then clench your teeth, okay? And then move it side by side, Okay, very good. So there was full movement, range of motions against resistance. And then for the trigeminal nerve, also there's sensation of the face, okay? And trigeminal is both motor and sensory. So this is gonna be my sharp object, and this is gonna be my soft, okay? So I'm gonna ask you to close your eyes, and then I'm gonna touch, and then you tell me if it's soft, if you feel soft, or sharp, okay?
Sharp, soft, sharp, sharp, soft, sharp, sharp, soft.
Okay, very good. Patient was able to distinguish between soft and sharp movements, so cranial nerve number 5 is intact. Now we go to cranial nerve number 7, and that's the facial. The facial number 7 is sensory, and it's also motor. For the sensory, we have the first 2/3 of the tongue, there's the taste. So that's the sensory on that one. And then for the movement, for the motor part of it, I'm gonna ask you to please smile, okay? Clench your teeth, okay? Raise your eyebrows, okay? And now puff up your cheeks, okay? Very good, thank you.
You're welcome.
Patient able to perform movements of the face, so cranial nerve number 7 is intact. Now we're gonna go to cranial nerve number 8, and that's acoustic. So that's the hearing portion.
Okay.
Cranial nerve number 8 is sensory. Okay, so there are 3 tests that we're gonna do. First, I'm gonna do the whisper test. I'm going to ask you to close one of your ears, and then I'm gonna tell you 3 words. I'm going to whisper. For the purpose of the video, I'm not gonna whisper. I'm just gonna be a little bit louder and stuff, but just so we can get, just so you can hear, they can hear, okay? All right, so go ahead and close your ear, okay? And then just repeat after me. Blue,
Blue,
ball,
ball,
apple.
apple,
Okay, very good. Other one? Apple,
apple,
book,
book,
table.
table.
Okay, hearing was intact during whisper test. Now I have the Weber test, and I'm just gonna have you listen to it. I'm gonna put it over your head. And with this one, I'm just looking for any loud hearing on one ear or the other. Okay? So tell me if you hear them equally or if it's louder on one side.
It's the same.
Same? Okay. There's no lateralization of sound. And on this one, I'm gonna check for hearing conduction. Okay? And this is the Rhine test. So I'm going to place my hand, and you're gonna hear it, and I'm gonna count. So let's just do it. So let's do it on this side, your left side. So just let me know when you stop hearing, okay? And then I'm gonna place over in front of the ear, and then you tell me when you stop hearing again.
Okay.
Sorry.
Okay. Still hearing. Okay.
Stop. Okay. It was double. Okay, that's very good. Now I'm gonna do it again on this one. All right. So when you stop hearing, you just say stop.
Okay. Stop. Stop.
Okay, very good. So bone conduction was twice as long as air conduction. Actually, air conduction was twice as much as bone conduction, so that's a normal finding. So with those 3, cranial nerve number 8 is intact. And now cranial nerve number 9 and 10 are checked together, glossopharyngeal and vagus nerve, okay? And for the glossopharyngeal, they're both sensory and motor. And on the sensory part, they control the 1/3 of the posterior taste on the tongue, also one third posterior sensation on the tongue and the throat, okay? And I'm gonna ask you to just say ah. I'm gonna check your uvula, okay?
Okay.
Okay, very good. Uvula rises midline and there's no deviation. And now can you just say ah again? Okay? Okay, there you go. Gag reflex is intact. So cranial nerves number 9 and 10 are intact. So now with cranial nerve number 11, that's the spinal accessory muscle. And so I'm going to be checking your resistance against force, okay? So go ahead and just shrug your shoulders against my hands. Very good, thank you. Now turn your heads laterally, side by side against my hands. Very good. Just turn your head. Yes. Okay. Thank you. Very good. So there was full resistance of shoulders and face against my hands. So cranial nerve number 11 is intact. And now cranial nerve number 12. And that's hypoglossal. And with that one, we're just checking for movements of the tongue. That one is motor. And then I'm just going to ask you to show me your tongue. Okay, very good. And I'll push against my hands inside, against your cheeks. Push with your tongue against your cheeks.
Like that?
Your cheeks.
Oh.
There. Thank you. Thank you. Very good. Okay, so there was full force against resistance, and cranial nerve number 12 is intact. All right.